My name is Markus Weingarth. I work at Utrecht University as an associated professor. I use solid-state NMR to study the mechanisms of antibiotics. We are interested to understand how antibiotics work in medically relevant conditions. We are especially interested in antibiotics that destroy the cell membranes of bacteria. And there, solid-state NMR offers unique advantages as we can study in real membranes, even in native cell membranes, how exactly these antibiotics destroy bacteria. This does not go into the metabolomics field, so this is really to understand how exactly an antibiotic binds a specific target, in our case, a specific target in the bacterial cell membrane. And if we understand how exactly antibiotics targets, for example, a specific bacterial lipid, then we can try to improve these antibiotics, try to break bacterial resistance, and try to make better drugs that cure people. Well, we feel very happy, very excited about the arrival of the 1.2. What do we expect from the 1.2? We expect higher sensitivity, better resolution, and I believe that from the data that we have acquired as far, this is exactly what we got. So the data, especially for solid-state NMR, are much better than with previous magnets. So there's a clear gain in spectral quality, and this is really important for our research because we want to. Our ambition is to understand the mechanism of drugs, of antibiotics in native conditions, and in native conditions, sensitivity really matters because in artificial settings, you may have a large amount of drug target, but in cells you have only a very tiny amount of drug target. So a tiny amount of drug targets translates into a low sensitivity. So we need big machines like the 1.2 in order to improve our sensitivity, in order to work in medically relevant conditions. So we are really excited about this machine. Well, I do hope that there's a benefit. We work on antibiotics. We try to understand how these antibiotics work. Once we understand how these antibiotics work, then we can make better antibiotics. We have contributed to a better understanding of antibiotics. For example, we have just recently solved the mechanism of an antibiotic called teixobactam that is heralded as a game-changer drug. This was a study that is just accepted in Nature. And also here the studies data were acquired on the 950 instrument from Bruker. We have follow-up projects on the 1.2 that look really promising. And I believe that the knowledge that we generate on these new antibiotics provides critical insights how we can make better antibiotics, and that's necessary. In the future, we want to address medical questions of increasing complexity. For example, we want to understand killing mechanisms against difficult to treat bacterial pathogens such as Mycobacterium tuberculosis or MRSA, because these organisms that cause millions of deaths per year, they cannot be treated with conventional antibiotics. So we need to, and in order to understand killing mechanisms against these antibiotics, we need ideally directly work with membranes of these antibiotics. So, with membranes of these pathogens, and we have made inroads in this direction. And also here, the higher sensitivity that the 1.2 can provide us will be critical in order to find better drugs against these dangerous pathogens.